Today, I'm going to tell you how your legs and feet can warn you about your health. I'm a medical doctor, and I train in internal medicine, which means I take care of men and women, young and old, and healthy and sick. And I'm also a scientist who studies blood vessels. And blood vessels and what they do actually lead to those signs in your legs and feet that tell you if you got a heart problem. So I'm an expert on circulation, and what I'm going to tell you today will help you pay attention to what's going on in your legs when it comes to your circulation. Now, your blood vessels bring oxygen and nutrients, and all the oxygen that you breathe and nutrients that you eat right to the cells, muscles, tendon, and bone in your legs and in your feet. When those blood vessels are working well, you're actually going to be able to walk around and run and do all the things that you normally do in life without a problem. When those blood vessels have a problem, one of the common problems is that they get blocked up with atherosclerotic plaque. They narrow down. Now think about it. It's like a drinking straw that you cut in half. What's going to happen? You're not going to get as much fluid in it, just like if you had a half the size of a drinking straw. Same amount of sucking up the liquid, it's going to be a lot harder and you're going to get a lot less. Now, that's frustrating when you're actually drinking out of a small, thin straw, but it's actually terrible when it actually happens in the legs. When your legs don't get enough blood flow because your blood vessels are narrowed, then you actually have a crisis in your legs, right? Because your muscles, when they're contracting, need oxygen and they also need energy. They need glucose. They also need all the other things that are actually happening that your blood is carrying. So what happens when there's a compromise? Well, a sign that something's going on with your legs and feet is when you've got cramping. Now, we've all had cramping before, but I'm talking about the cramping where you just walk like 100 yards and all of a sudden you can't walk anymore, like you've got this terrible cramp. And it can get worse and worse where you then walk even 100 feet. Or if you were in a shopping center from, one part of the store to the next, you can't actually continue because you get terrible muscle cramping. That's actually not normal. That's a warning sign that you're having blood flow problems right in your legs. Without enough blood flow, your muscles cramp up, all right? And you got to stop. So cramping is one of those warning signs, telltale warning signs that there is something actually going on because your muscles are carrying around your frame. They do a lot of work. And then when you're actually walking around, they consume a lot of energy. And if they're not getting that energy, they're not getting that oxygen, they're going to seize up and you're going to actually have a cramp. Now, this is the condition that's called peripheral arterial disease. Peripheral because it's not central in your body, all right? It's sort of in your periphery. Your legs are considered the periphery, your legs and feet for sure. Peripheral arterial, so this means that the arteries are getting narrowed, right? And disease, obviously. PAD is what we call it, peripheral arterial disease. If you were in England, they call it PAOD, peripheral arterial occlusive disease. Occlusive means it's actually getting very, very narrow. And this is actually a problem that I know about because what you really want to do is to stimulate new blood flow in order to be able to grow around the blockage, to restore blood flow. Right now, what happens if you have this type of cramping, a surgeon, a vascular surgeon, will do all the studies to define exactly where the blockages are. And they can take a catheter through your groin and stick a balloon all the way down into where the blockage is and blow the balloon up, press the plaque out or just actually rotor-rooter out the blockage and put a stent in. Okay, this is like a wire basket that pops open and pops that blood vessel open where it was narrowed. And now you've got blood flow again. So you can actually solve this problem of peripheral arterial disease with a stent or angioplasty, which is actually where you blow up the balloon to be able to open up the blood vessels. Now, listen, this is not a local problem. People with peripheral arterial disease have a systemic problem, so it's narrowing of the blood vessels everywhere. These are the people that have narrowed the blood vessels in their organs, in their brains, so they can also have basically narrowing of the brain blood vessels, and that can lead to cognitive issues, memory problems, and in fact, ultimately vascular dementia. Vascular dementia is much more common in Alzheimer's disease. It's actually something that we see as blood vessels get hardened, okay? So now you learn about one warning sign that is actually cramping in your leg. Now, a warning sign number 2 that you should be aware of is when you actually have a wound on your feet that doesn't heal. Now look, most people, if you cut your feet on something, like step on a piece of glass, step on a nail, hopefully you had your tetanus shot, but let's say you cut yourself, what's going to happen? First, you're going to react in pain, ouch, pull your feet back, and then you're going to lift your foot up, okay, and you're going to see if it's bleeding, and if it's bleeding, you're going to rinse it off, you're going to wash off all the bacteria that might be on there, could have put a bandage on it, right? And basically, as long as you keep that clean, and it's not too deep, and you've removed all the foreign material that's there, which is why you want to really wash it off well, that wound will heal up. I mean, it starts to heal as soon as it forms, but by a week to 10 days, your wound will actually do pretty well. The foot, the bottom of the foot especially, is a very dirty part of our body because it's in contact with the ground or the inside of your shoe. You know, we wear shoes so we don't actually get our feet dirty, but you know how dirty the inside of a shoe is? Nasty. Inside of an old tennis shoe, or, you know, an old pair of work shoes that you're actually wearing every single day, not good. So if you're going to actually cut your foot, normally, wash it off, put a Band-Aid on. You might want to put a sock on before you slip it into a shoe. And a lot of people say, well, I'll just walk around in flip-flops. Well, be careful, because then the bottom of your foot's exposed to everything. So put a bandage on, check it, change that Band-Aid after a day or so. And when you take a shower, take a little bit of soap and clean off the cut area as well. Believe me, if it's normal, a cut on your foot will actually heal up. But that's not the warning sign. The warning sign is actually when the wound that's on the bottom of your foot doesn't heal. In other words, the wound, you get a cut, the cut may not even be painful, but it's there, and it stays there more than a few days, more than a week. It's there 2 weeks later. What? It's not healing yet. It's 3 days later, still not healing. A lot of people don't even know that they actually have a foot wound, particularly if they've got diabetes, because the nerves in some conditions like diabetes are dying back. If you don't have enough nerves in your foot, you're not going to feel when you actually cut your foot, right? Now, those nerves are dying back because the blood vessels that support the nerves are damaged. This is one of the issues with diabetes. You've got a diabetic neuropathy, which is actually a problem of the nerves dying back. So diabetics have difficulty feeling the soles of their feet. Very easy to step on a piece of glass, all right, and that be cut, and you don't even feel it, all right? Now, one of the reasons that the nerves are dying back is that the blood vessels feeding the nerves are insufficient or they're blocked up, all right? So every nerve has its own blood supply feeding it. It makes a lot of sense, right? You got a telephone line that's going from pole to pole along a highway. You're going to have a support line going along with it, and those blood vessels are the support lines bringing oxygen and nutrients to the nerve along its entire journey on the bottom of your foot. Now, I told you that in diabetes, there's blood vessel problems, and those blood vessels feeding the nerves are not normal. They're dying back, and now without oxygen and nutrients, the nerves die back. And now you have an understanding of what diabetic neuropathy actually is. Problems of the nerves start with problems of blood vessels, and that's an area that I study. So that's why I'm going to give you this level of detail. Now, when you cut yourself, you need blood vessels to grow back. That's a process called angiogenesis. Angio, blood vessels, genesis, how they grow. And this is actually very, very important from your entire life, that your body is able to use this process of angiogenesis, one of the health defense systems, to make sure that all the tissues in your body have the right amount of blood at all times, all right? And you got to get the right amount of blood flow. So in diabetes, you wind up having damaged blood vessels. It's the lining of the blood vessels, the endothelium is what we call it, is damaged, all right? And when that's damaged, the blood vessels actually more easily clog up, okay, and also clot. And when you have those ever narrowing blood vessels, that happens in diabetes. When those are the blood vessels that follow the nerves and support the nerves, when those blood vessels go, guess what? The nerves go. So diabetic neuropathy, diseases of the nerves, are partly caused by diabetic vasculopathy, meaning that diabetes causes a problem in the health of the blood vessels. Bad blood vessels to nerves, bad nerves, right? So this is what actually happens in the feet of people with diabetes. So they don't even feel it when they step on a nail, when they step on a tin can, when they step on a piece of glass. And that cut that occurs, actually, you can be dragging it around for a long time if you're not checking the bottom of your feet. If you don't feel a pain, remember I told you, normally you step on something, you cut yourself, boom, you pull your leg back and you go check your foot. That's the natural instinct. But if you don't feel it, you're just going to, after the cut, you're going to just slide your foot back into your bare foot back into the shoe and tool around. And you might not even know that you actually had a cut. And in fact, some people with diabetes winding up having these foot wounds don't even know that there's an injury until days later, maybe weeks later. They start smelling something really foul coming from their body, and it turns out to be coming from their foot because now they've got rotten tissue. That wound has not healed, and that's the warning sign, a chronic wound that doesn't heal. This is actually something that's pretty common, unfortunately, in diabetes, and also it can also happen with peripheral arterial disease. But it's kind of a silent epidemic. People don't like to talk about holes on the bottom of the feet that aren't healing. And doctors actually don't know. Most doctors don't know how to actually handle a diabetic foot ulcer. Now, I happen to be one of the people who've led the charge, both research, treatment, policy wise, to figure out how to actually heal these chronic wounds. Because you know what happens if you don't heal that chronic wound? Unfortunately, that wound will get deeper and deeper because it's not healing. The bacteria will kind of get in there, and it'll start oozing pus. All right. And then the tissue will start to die in that area. And eventually you could actually get an abscess. The bacteria can get into your bloodstream. You can get septic. And by the time many patients actually wind up going to their doctor, and their doctor goes, hey, I don't know what to do with that. Finally, the patient gets referred to a wound clinic. All right. There are, several hundred wound clinics around the country, not enough of them by any means compared to the number of people with diabetes. And those special wound clinics have trained staff and experts, clinical experts, that know how to actually apply advanced technologies to be able to start healing that wound. If you don't go to the doctor, all right, you're going to be walking around with basically a rotting piece of your foot that's going to get worse and worse. And when that rot continues to go bad, you can get gangrene. So the treatment for diabetic foot ulcers, when it's detected early on, we'll clean out the wound. We'll maybe even cut out the non-healing wound to kind of get a fresh margin. And then there's all kinds of different tricks of the trade that can be applied that actually work really well. Everything from putting a living skin equivalent, it's kind of like a living bandage on it to help heal. There's a growth factor. It's like it's called Regranix bicapillary. It comes like in a small tube, like a travel tube of toothpaste. You squeeze some on there. It's a protein that stimulates angiogenesis. So it stimulates healing. That's already way too slow in the diabetic foot, somebody with diabetes. So just go ahead and stimulate it. And in fact, this growth factor gel, the thing that comes in a toothpaste called bicapillary, was FDA approved because clinical trials showed that it actually sped up the rate of wound healing. What does it do? It stimulates angiogenesis. More blood vessels growing. Guess what? Not only is it healing the wound, repairing the wound, but the other thing that it's actually doing is that it's also helping to restore the nerve function as well. And nerves will grow back. Nerves will grow back if you allow them to grow by eating the right foods, by not killing the nerves some more. Nerves grow back about 1 millimeter a day. That's about a millimeter right there. Okay, a tiny bit. Then the next day, then the next day, and the next day. You can actually grow nerves back pretty quickly, all things considered. All right. So the warning sign we're talking about here are chronic non-healing wounds that might be on your foot. You should always check your feet. If you've got diabetes, before you go to bed, you should, cross your legs, look at the bottom of your foot on the right, take a look at the bottom of your foot on the left, check around your ankles, make sure there's no wounds. And if you're actually taking a shower, That's another example, another opportunity to be able to take a look at your skin on your foot and also keep it nice and clean. All right, soap up your foot. That's actually a really important little tack, I would actually say, in order to be able to avoid the problem. But if you actually have a non-healing wound, time to see a doctor. All right, you're probably going to need to be seeing a wound specialist, somebody who works in the wound clinic. But don't be afraid to advocate for yourself and ask your doctor to refer you to a wound care center. All right, they're around and they have all the technology, all the tools, hyperbaric, living skin equivalents, growth factors, all kinds of different things. Most importantly, the experience of actually getting a wound to actually heal back up. If you don't, I'm just telling you, these wounds will get worse and worse. They'll get infected. Your immune system in diabetes is also lower. So now you've got poor blood vessels, poor nerves, and now you've got an infection and your immune system's also down. This is why diabetic foot ulcers are a common reason that doctors wind up amputating the feet and the legs of patients who have these chronic wounds. So you don't want to be there. Trust me on this one. All right. So that's the second warning sign, which would be actually a wound on your foot that doesn't heal. All right. Now, telltale sign number 3, major swelling in your feet and ankles and into your calves. Right. And you've probably seen this, recognized this. I mean, you've seen somebody, maybe they're on a bus or in a subway. They might even be on a plane, maybe on a beach, but somebody who's got, really, really swollen calves and ankles and foot, and the foot is sort of kind of like pillow shaped, really, really swollen, and it's actually filled with fluid. Now, swelling in the feet can actually happen for a lot of different reasons. All right. Some of the reasons that are harmless are, for example, if you're on a long plane flight, say you're flying across the country, flying across the ocean to Asia or Europe, you're sitting there for a long time, and even though an airplane has a pressurized cabin, they artificially put air pressure in the cabin. It's a lot less than when you're actually not in an airplane standing on the ground. All right. So with lower cabin pressure compared to what is on planet Earth when you've got your feet on the ground, less pressure means that the water inside your body can seep out under the skin, not through the skin, under the skin, from your blood vessels, out into the tissue, out towards the skin, and the leg, the calf, ankle swells up, the foot swells up. All right. That's called pedal edema, P-E-D-A-L, pedal edema. And the fluid's pooling into the connective tissue in your under your skin. Now, we test for that to see if it's really fluid that is just oozed out by pushing a finger into the swollen foot or ankle or calf. When you push in, it's kind of like the Pillsbury Doughboy or pushing into a ball of pizza dough. You're going to get a fingerprint in there, or a thumbprint if you use your thumb, right in there, okay? And you'll see the indentation will stay there for a little while before the fluid comes right back out and actually removes and fills back out your fingerprint or thumbprint. That's pedal edema. And it can actually happen a little bit when you're flying on a very long haul flight, not enough air pressure. And so for some people, not everybody, for some people, the fluid actually comes out. And that's a relatively harmless situation. If you're taking a flight, once you land, you might have a little more problem than you'd expect by putting on your shoes. But then once you're walking around, okay, you get your luggage from the overhead, you walk off the plane. Now you're walking through the terminal to the baggage claim or wherever you're going. All right. That physical activity back on terra firma, on regular Earth, okay, with higher pressure is going to push that fluid back into your blood vessels, and then your veins will actually take it all back into your heart. And now it's out of your ankles and calves and feet back into your body. All right. So that's the harmless kind of swelling. But if you have it, you want to pay attention to it because, it's something that it's just one of those telltale signs that something is going on. Under normal conditions, it's just less air pressure around you. Okay. But it's hard, and that's particularly harmless. However, There are situations where edema can signify something really, really severe, all right? Lower extremity edema is what we call it, all right? Now, one of the things I told you about are these really fat, swollen feet and ankles. And now when you actually put your finger on it, pitting edema, it's like I said, like poking a piece of pizza dough. You'll see the hole where your finger was, and it will take a long time before it actually fills back out again, all right? And this can actually go all the way up your shins, all the way up to the calves as well, all right? You get that dimpling if you actually put your finger on it, all right? Now, that's the kind of fluid that has actually come out, and the fluid is not going back in the blood vessels to the heart. So this pitting edema is actually not a normal situation, and it can actually happen when you have congestive heart failure. So pitting edema, all right, big fat calves, ankles, and feet, all right, might be a sign that you have congestive heart failure. And that's why when you have edema that doesn't go away, time to talk to your doctor and get some attention to it. You know, even though we're talking about the foot, that might actually be the tip off that there's something going on with the heart. And a doctor can actually use an ultrasound and do a stress test and do all kinds of different types of testing in order for you to be able to actually check the vitality of your heart. All right. Now, how does heart failure cause leg swelling? Well, you know, our circulation is a closed system. So the heart right here is pumping, 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 jetting blood out through the artery, the big artery is called the aorta, right over the top, kind of like a fountain, like the fountains of Bellagio. Squeeze, pump, blood goes out the heart, all right, and the arteries take it to all the rest of the body. But what happens is that it has to return, the blood has to be returned on the other side through the venous or vein system, all right? Now, if the heart is not doing vigorous pumps, but it's getting blood out there and the blood is coming back to the heart, but the heart can't accept it fast enough. So you're pumping out, and now it's like wiggly jiggly. It's not ready to accept more. You get more fluid is coming back. Yep. Well, okay, we'll get it again. Let's do another pump, and it becomes kind of like a feeble, half-hearted pump. What happens to the water, the blood that was supposed to come back? The blood backs up. Okay, it's like a toilet that's not flushing completely. The fluid backs up, and then when it backs up from your heart, it backs up all the way on the other side of your veins. Right, you're not moving fluid through your heart. That's supposed to, fluid comes into the heart, fluid is pumped out of the heart. That's how it's supposed to work. But if the fluid isn't going out of the heart as quickly, it backs up. And when it backs up, you know what? It backs up and goes down the column of fluid that's called gravity in your venous system in your body. And then it builds up in your legs and feet because those are the lowest parts of the body. All right. Unusual, severe swelling that when you poke it, you leave a dimple in it, could be a telltale sign that there's actually a heart problem. So this is basically how legs and feet can tell you something very important about something that is not below the waist, all right? And if you actually suspect you've got congestive heart failure, it is time to go see a cardiologist. And your primary care doctor should be right on it, okay? This is not difficult stuff. This is common sense stuff. When the pump's not working well, the blood's going to back up because you're trying to jet it out. It's not working efficiently enough, so the blood backs up. That fluid goes down the column of your body, leaks out through the blood vessels, accumulates within the muscle and tissue of your lower extremity, your calves, your ankle, your foot, and then they swell up, and you can dimple them. All right. Now, that's a warning sign. Okay, let's talk about the next warning sign, and these are called venous leg ulcers. It's also a kind of wound, but it's not like a diabetic wound, which is kind of round and deep. Venous leg ulcers are kind of, they can take any shape. They kind of look like the map of the United States, for example, or an island from outer space. If you took a picture from a satellite, it's an interesting geographic shape and not very deep. This is not a deep wound, but it can actually be a very large wound in terms of surface area. It's just a shallow sea, kind of like the Salt Lake in Utah. Not very deep, but really wide, and it's got really irregular borders. That could be a venous leg ulcer. And if you haven't heard about venous leg ulcers, don't worry. Most doctors, your GP, probably doesn't really know what one is either. They're pretty common, but the regular doctors, your GP, your primary care doctor, probably doesn't know how to manage it. Now, so let's talk a little bit about these shallow wounds that can form around your calves, near your ankles, on top of your foot, but it's generally sort of between your knee and your ankle, all right? They're not deep, they're very shallow. And what's happening is, again, let's go back to the blood vessels. You have a problem called venous insufficiency, all right? Venous meaning veins, right? Arteries are the blood going out of the heart. Veins are the blood coming back into the heart. And the blood vessels that bring the blood back are called veins. And the veins are insufficient, all right? That's venous insufficiency. What is it about those veins? What part is insufficient? Well, let me explain to you. So when the blood is actually finishing the arteries and it's going to go back to the heart, it gets, it goes down to your legs. It's got to get pumped all the way back to your heart. Now, remember I told you is that the blood, when you're standing up, the blood can pool very easily. So the way that Mother Nature designed the return system is that blood that was pumped out gets collected back into the veins and that vein starts to bring the blood back to your heart. Now, in order for that blood column not to sink and cause your legs to swell, the fluid to leak out and swell, there are valves in your veins, all right? And these valves allow the blood to get pumped up, and then the valves open up like this, okay? And now the blood can't go back, and a whole water column is trapped. And then the next pump pumps that column of water a little bit higher. Oh, another valve system traps it so it can't fall back down. Okay, another pump, boom, the blood column goes up, and then it falls back to another valve. And these valves actually keep the blood going up, back to your heart. All right, very, very important concept. So venous insufficiency, all right, what do you think happens when those valves don't work, or one of the valves don't work? Let's say there's a failure of a valve. Well, that column of blood on its way back to your heart isn't going to actually stay in one place because there's nothing that's propping it up. So it's going to fall back down, and just like a dominoes, the next one falls down, the next one falls down, and now you've got blood that's actually pooling again in your leg, kind of like congestive heart failure. But in this case, the ticker is okay, but the valves in the veins are failing, okay? They're insufficient. So this is called venous insufficiency. And what happens is that in your leg, so let's call it below the knee, that back up of fluid that then leaks into under the skin, okay, and creates that big fat leg and dimpling effect I told you about. Well, look, in venous insufficiency, it's really the superficial area, the thin part of the skin that wears down, all right? And a little hole will actually get bigger and bigger and bigger. Usually it doesn't bleed, actually. It's just kind of like area of the skin that's breaking down. So much fluid is out, stretching the skin. The skin's not getting enough oxygen, all right? And all it takes is for a tiny little thing, a bump, on the side of a table or tripping on a branch or something like that. And now you're actually going to scrape off some of the skin, and venous leg ulcers start to form just because there's so much fluid, all right? And when they start forming, as I mentioned to you, they're not deep wounds. They're very shallow wounds, but they can actually cover a huge area. And that is called venous insufficiency. So you tell your doctor may or may not know what to do with it, all right? And they're not sure, you should ask your doctor to refer you to a wound clinic. They're all over the country, all right? But they're really, really specialized. These are Navy SEALs for wounds. They know exactly what they're doing, and in ways that your regular doctor are not going to know. And if they don't know, if your own primary doctor doesn't know a wound care specialist, that's fine. Just go online and go ahead and look up wound associations. There's a few of them out there. I'm on the board of one of them. And some of them will actually have lists of providers or healthcare providers or wound clinics you can actually go to. There are some really, really good ones. And by the way, a conference that, I have gone to for many, many years with nurses and doctors and surgeons all going to this conference is called the Symposium for Advanced Wound Care, SAWC, all right? And that's where it takes place twice a year, different cities. And that's actually where you can meet some of the wound care providers. So I know that in the past, when I've been at that meeting, sometimes patients will show up. All right. They hear about the meeting, they show up, and guess what? They are suddenly right in the middle of all the experts in the country for wound care, and they can, introduce themselves and often get help that way. So if you got a venous leg ulcer, you want to let your doctor know. If your doctor doesn't know how to deal with it, and they should refer you. If they don't know how to refer you, well, you might be actually stuck looking for it yourself. But you're searching for wound clinics in your zip code or in your city. So venous leg ulcers are another warning sign, shallow wounds in your legs, your lower legs. All right. This is very common in older people. They generally are pretty hard to heal. But if you see them, I'm just going to tell you, because I'm one of the experts in this area, what to do for wounds. Wrap it. There's compression. And what you want to do is kind of keep enough compression there, because guess what? Valves aren't good enough to keep the fluid going forward. Well, maybe we need to squeeze in a little bit. That old ACE bandage, you can wrap it around the leg, not loose, pretty tight, because you want to actually, kind of force the blood to go back into the system. And that'll actually be helpful in terms of the healing as well. All right. So compression is the primary way of closing or healing these wounds. But if it's still not healing, again, a wound care provider might put some growth factors on there, might put a living skin equivalent on there, amniotic membrane. They might give you a hyperbaric oxygen. This is where you go into a little chamber, originally developed for deep sea divers who come up too fast and get the bends. So this hyperbaric HBO is intended to help divers avoid the bends. But guess what? It actually could be useful for healing the wound. So I'm going to tell you exactly what happens if you pop into one of these HBOs, hyperbaric oxygen centers. So at a wound center, they might actually put you into a hyperbaric chamber. And what this hyperbaric chamber does is it puts lots of oxygen under a high oxygen pressure to flood your body, but especially the wounds, with high oxygen, right? So I just told you these chronic wounds occur because they're not getting enough oxygen. So let's go and flood the area with oxygen in order to be able to get more oxygen, which is necessary for healing. And you think that, well, you keep on doing dives, and every time you're getting the oxygen, the wound is healing a little bit. Actually, that does happen a little bit, but what's really happening, and this is where I'm coming at this from a researcher, kind of an expert in this field, is that you're training every time you go into a dive chamber, a hyperbaric chamber, you are pumping the wound full of oxygen during that 1 hour dive, let's say 20-minute dive. The tissue, your own tissue where the wound is getting used to the party of actually having a lot of oxygen. All right. So then when you step out of the dive chamber, all right, you're going to get back in your car and you're going to drive home. The visit's done. Well, actually, it's what happens is that when you're actually out of the chamber, before the next time you go into the chamber, your wound, not after the first time, not after the second time, maybe starting after the third time you do a dive, when you come out of the chamber, it's so used to having a party with a lot of oxygen around that when you step out and you get into the car, into the parking lot, your wound feels like it's choking. Oh man, I'm not getting enough oxygen. All right. And then this is the setup for what actually happens, because when tissue feels oxygen starved, all right, this is called hypoxia or relative hypoxia. I mean, it's just in regular air, so it shouldn't be starved of oxygen, but it's been trained to be addicted to high oxygen. That's how HBO works, this addiction. Now the wound goes, we don't have enough oxygen. Let's go ahead and create proteins and release proteins ourselves in a wound, like vascular endothelial growth factor, VEGF. This is an angiogenic growth factor, a protein that causes blood vessels to sprout. It's like putting fertilizer on the ground, all right, and then putting some grass seeds on. What's going to happen? You're going to actually grow lots of grass, and this is what happens after between dives, is that your wound senses it's not getting as much oxygen as would make it happy, all right, because you've trained it, and now it sends out these proteins to grow new blood vessels. And once you have angiogenesis, and you turn on the genes for healing, now that venous leg ulcers will begin to actually close, meaning that the skin grows over, less wound is exposed. The less wound that's exposed, the less chance there is for infection. All All right. So a lot of ways to actually deal with venous leg ulcers, but that's another warning sign. So what did we talk about? We talked about cramping. We talked about swelling, right? We talked about wounds that open up. We talked about diabetic wounds. We talked about venous wounds. All right. So these are all things that we should be paying attention to. These are the warning signs on your legs and your feet that you have actually a problem. And then here's another one. All right. And this is the last one I'm going to talk about. The fifth warning sign, if your toes become black toes. All right. And I'm talking about black like burnt hot dogs. All right. And this, again, is a sign of peripheral arterial disease. This is the condition where blood vessels get narrowed or blocked. And now the tissue, in this case, the toes, are not getting enough oxygen. And when it gets severe enough, basically the meat of your toes, the flesh of your toes, the muscle in your toes, the bone in your toes, just basically dies. All right. It's just not getting enough oxygen. All right. And when that actually happens, when that tissue dies, it turns black and it'll actually dry out and you'll wind up getting gangrene. That's what it is when your toes turn black. All right. Now, remember I told you this is the process, this narrowing of the blood vessels is the process, not just in the toes or the feet. It's happening everywhere. The narrowing is happening in your heart. It's happening in your lungs. It's happening in your liver. It's happening in your brain. So this is a telltale sign. If you wind up actually having black toes, you're probably having narrowing of the arteries elsewhere in your body as well. You got a problem, not just of the toes. That's serious enough in your toes, but there's the tip. This is a tip off that you better go have the rest of your body checked out. So who actually does the checkout? Well, vascular surgeons are, this is their domain. This is their bailiwick. They're supposed to know. That's what they do, how to assess your circulation all throughout your body. But the black toes, that's a great sign to be able to pay attention to. All right. If you don't have enough blood flow to your foot, the toes can turn black. You don't have enough blood flow to your heart, you can get a heart attack. Not enough blood flow to the brain, you can actually start to lose cognitive power. You become dull as opposed to sharp, sort of mentally. That's not what you want. And that's the problem that's actually happening everywhere. Black toes, a clue you're not getting enough circulation to any part of your body. And in the toes, when the skin dies, it actually turns black. Now that black is called gangrene. And gangrene is a very dangerous condition because essentially not only does it tell you that your circulation is compromised all over, including your brain and your heart, but the fact of the matter is that eventually that gangrene can spread to the rest of your foot. All right. You might have to amputate your foot. It can spread up even further and you might need to amputate upstream to the upper part of your leg as well. All right. So this is peripheral arterial disease leading to less blood flow. All right. All the way down to the tippy toes, literally. And when the toes, the meat of the toes, the muscle, the flesh, the bone, connective tissue, don't get enough oxygen, they basically die. And when they die, they turn black. So blackened toes, a sign of danger that's happening elsewhere in your body. Time to see a doctor who should be referring you to a surgeon. Not just any surgeon, but a vascular surgeon. Because one of the things that they'll do is they'll do a scan, all right, an angiogram. And this is basically like a kind of an x-ray, but they inject a dye into you that circulates all throughout your body. And in fact, and basically they are able to map out where the narrowing is occurring in your legs. All right. And once they actually pick out where that narrowing is, guess what? They can send in the A-team to try to see if they can open up the blockage. Now, I told you this is happening all throughout the body, so it's very unlikely it's just one area. And so vascular surgeons have to assess this by squirting the dye. Is it one area they can get to, or is it diffuse, meaning it's a little bit of narrowing everywhere, which is often what's actually happening with peripheral arterial disease. Now, I took part in efforts years ago to be able to develop lots of treatments to actually be able to get around this peripheral arterial disease to avoid blackened toes and to heal the wounds. These arterial ulcers is what we call them. I can tell you some of the most impressive work that still isn't ready for prime time, but I'm just sharing an experience with you, is doing gene therapy to deliver the gene, the DNA, that codes for one of the growth factors that helps stimulate angiogenesis and healing. And what we did is, there was a big clinical trial. The gene was injected into the muscle of the leg, all right, all over. And lo and behold, what we found is that blood vessels would grow in oxygen-starved legs, so we could actually stimulate angiogenesis by delivering genes through gene therapy. I mean, this is pretty futuristic stuff, right? Yeah, well, look, I took part in it. I can tell you, although it's still early days of development, but in the clinical trials, I will tell you that there were some patients for whom it was a home run. All right, we haven't been able to repeat that enough people to really call it a win, so that's why it's still research area. But I can tell you, the world of discovery, innovation, and breaking new ground, if you want to be a path breaker, particularly in medicine, all progress begins with one patient. And so I can tell you, I've seen that one patient respond beautifully when you do angiogenic gene therapy. And now it's still in development because it's a steep road to solve it. How do you design the trials, et cetera, et cetera. In any event, that's actually for the future. All right. But you go see a vascular surgeon and they'll actually take some dye, inject it in, see what the blockage is. And they might be able to go snake in a catheter right up to the blockage, put a balloon in it, poke it right through the blockage, blow up the balloon. When they blow up the balloon, the plaque gets pressed back. They can even suck out the plaque if they're drilling through it. Suck it out, all right, put it into a bucket on the other side. This is all going through your groin. They can put a stent, a basket, and it goes, deploys open, and now the vessel, the artery won't close down, can't shut down, all right? And that's actually a way of actually opening up the blood vessels to restore blood flow. Now, if you can't, sometimes the blockages are so serious or the anatomy is so difficult that the vascular surgeon can't quite get to that area. I can't kind of get through that area. So now what do? Now you can actually undergo bypass. Peripheral arterial disease can be treated with bypass surgery. So basically what you do is you just, the surgeons will actually take a vein and just plug it on one side that has good blood flow and then patch it in right beyond the area that's blocked. Say, you know what, we don't even need that blocked area. We're just going to go right around to supply the tissue. And so bypass surgery is a very important and still common way of actually dealing with this. We don't have gene therapy yet, but sometimes the basket can open up and angioplasty to suck out the bits. That can actually work as well. Now, what's really interesting is that there's some foods that look like they can be helpful to improve better blood flow. So let's talk a little bit about those. How do blood vessels that are narrow dilate? Well, you actually have something called nitric oxide. It's actually a gas, a normal gas in the body. When you've got nitric oxide, you take that blood vessel, and the nitric oxide, the gas, actually causes the blood vessel to dilate, expand. Now you got better blood flow right through it, right? Narrow blood vessel, add nitric oxide, and now it opens up. Now blood can actually flow right through it. So nitric oxide is not something that most doctors are using routinely, but guess what? There are medications that can actually stimulate nitric oxide. One of them is Viagra. Now, you know that Viagra is used for erectile dysfunction. What's erectile dysfunction? Not enough blood in the penis, right? Not enough blood flow captured in the penis during an erection. So the same thing that can actually happen in the brain. In fact, there was a clinical study that showed that men who are taking Viagra for erectile dysfunction actually had a lower rate of developing dementia, partly because the blood vessels feeding the brain were opened up and bringing better blood flow. Okay, so that's a drug. Not everybody wants to be on Viagra, for example. Like you'll get that like side eye from the pharmacist when you're filling that prescription for something that's not erectile dysfunction. But what foods can actually do that? Well, it turns out spinach and beets. Spinach and beets are two foods that actually can create that nitric oxide, help your body create that nitric oxide, widen your blood vessels, and actually help to deliver better blood flow, which could actually help. All right, it's not a magic bullet, but it could actually help to stave off amputation, to give you some more better blood flow, prevent more gangrene from actually happening. It's not the complete solution. All right, you really need a surgeon to be able to take a look at it. But I'm telling you, this is a tool in the toolbox that your doctor's not going to be prescribing you. And if you are actually facing such a serious condition where you've got black toes and maybe your whole leg needs to be amputated, you want to stay away from that. You want to do what you can at home to be able to save that tissue, all right, i.e. your leg. Check this out. I got a free guide on the 5 drinks to help remove fat from your liver, and it's free. I walk you through why your liver is so important, why you should take care to make sure it's functioning properly in your body, and the 5 drinks I recommend to enjoying, to support it. All you have to do is click on the link below and enjoy. So spinach and beets, these are produce that grow close to the ground, and the soil has a lot of nitrogen. So these plants absorb nitrogen into the root in the case of beetroot, and into the leaves in the case of spinach. And when you actually eat spinach or beets, all right, and you chew it, so I'm telling you, savor it. Make sure it's cooked in a way that you actually enjoy. All right, I'll tell you how I enjoy it. Here's one of my favorite spinach dishes. It's actually, I was inspired by Spain. You get spinach, you saute it in a little bit of extra virgin olive oil, some garlic, all right, you get this fragrant smell. Then you add some golden raisins into the mix, a little splash of white wine, the alcohol will burn right off, and then you toast some pine nuts and then throw them in there, turn off the heat, mix it together, and now you've got this wonderful spinach dish that tastes amazing. Now, why am I telling you about making the food taste amazing? Is because when you have the spinach, you want to chew it. Chew, chew, chew. Chew, chew, chew. Chew, chew, chew. And the reason that you want to do that for vascular health, blood vessel health, is that the microbiome on your tongue, okay, healthy bacteria in your tongue, when it's in contact with spinach, that food that absorbs nitrogen from the soil, and now you're chewing it, all right, and you're loving it because it tastes great. Now you're chewing it, and the longer you chew, the more contact the spinach has with your tongue microbiome. All right, and when that actually happens, the bacteria convert the nitrogen from the spinach into a form that when you swallow it, gets absorbed into the bloodstream as nitric oxide. The same thing that Viagra creates. It's also all throughout your body, and we know it actually works because within a few minutes after eating spinach in the manner in which I described, the blood vessels dilate everywhere in your body, and in fact, your blood pressure goes down a few points. All right. Now, this is actually quite impressive because normally you've got to give cardiac blood pressure meds to be able to do the same effect. Spinach will have that type of effect as well, but it's kinder and it's gentler in order to be able to do that. Okay. Now, beets, same way, right? So I love roasted beets, a little extra olive oil. You want to let the beets cool. What else could you do? You could get some orange slices, mandarin slices. Beets and orange slices are really good. You can put some balsamic vinegar on it. There's a lot of different recipes you can do with beets. It makes a great beet salad, for example. And if you don't know how to actually cook something like beets, type beets into Google, type recipe, and then type video, and up will pop all these videos, and you can actually play it and have somebody who knows what they're doing, meaning they know how to make a delicious beet dish. They will teach you how to do it. And if you do this in a grocery store, by the way, in front of the beet section, and you're like, what do I do with this like dark red, ugly, kind of dirty looking thing? Just take a few minutes in a video at a store and watch. They'll show you the exact technique of how to actually create a delicious beet dish And then usually they also talk about all the other ingredients you actually need to buy as well. Oh, and you're in the store. That's really convenient. Now you can make your own beet salad. But beets, when you chew them, the same thing as the spinach, chew, 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 chew. The healthy bacteria in your tongue will interact with the beets, the nitrogen in the beets that came from the soil, change it chemically in a form that when you swallow the beets, and the nitrogen, it's in a form that is absorbed into your bloodstream as nitric oxide. Dilates the blood vessels, blood pressure comes down. And by the way, it's even been studied that beetroot juice, this is just kind of like really intense red juice. By the way, you can make a risotto using that in the juice, and you get this beautiful beet red risotto rice dish. But back to the leg and getting blood flow into the leg, beetroot juice has actually been shown to also be beneficial. All right. So that's actually a little food tip for you. Spinach and beets can be helpful in dilating the blood vessels to improve blood flow to your leg in peripheral arterial disease. And if you wind up actually having black toes, this would be something that as you're working with your doctor, how can you get out of this jam? Well, there's something you can do for yourself at home. Spinach and beets are there. Now, some people will say, well, what about, oxalates and spinach and, beets and things like that? What do I do about that? I don't want to have kidney stones. I don't want to have gout. Look, you're balancing things. We're really talking about saving your leg. Let's focus on that. If the dietary approach isn't for you, well, maybe you need to ask your doctor or the vascular surgeon for other medications that you're probably going to be given, maybe to dilate the blood vessels a little bit. All right. And again, I'm not giving medical advice here. I'm giving information that you can take and do some more research on and ask your doctor about. Might give some medicine to dilate your blood vessels. All right. Because you can have nitrates. It's kind of medication that actually turns into nitric oxide as well, or even Viagra. All right. So again, and the other thing that the vascular surgeon will probably do is give you some blood thinners, which might sound scary, but many people are on them. It's actually pretty safe as long as you don't, get in the car wrecks and slam your head on the tile floor in the shower or anything like that. You got to be a little careful not to have accidents, physical accidents that could cause more bleeding. But otherwise, these blood thinners actually keep your blood nice and smooth. And actually, it's a way of salvaging and preserving your leg. In fact, there's a whole kind of subdiscipline in wound healing called limb preservation. That means don't cut off the leg. All right. So if that sounds severe, I'm just telling you, it's like pretty common. As somebody who has worked in the wound healing area, there's more people that wind up having gangrene and blackened toes than you'd actually think. All right. And by the way, this last example of the food is also showing you how the gut microbiome with the gut, this time in the mouth is part of the gut, how it interacts with the foods that we eat to be able to help support your health. Now, there's another way of actually stimulating healing and actually growing blood vessels in your legs. And this is, again, I know I talk about food a lot, but I also think that this is an area that many people suffer from, but they may not know how an experienced physician or an expert would actually approach it. So I'm sharing with you some pro tips that you can get armed and do research on and then bring it to your own doctor or vascular surgeon to advocate for yourself and say, hey, how about this? I'd like to get that. Now, one of the other devices that can actually stimulate blood vessel growth to preserve and protect your leg, all right? This whole video is really about problems in your feet and your legs that signify something else is going on. So let's stick to that. It doesn't have to be food. It could be anything goes, right, to save your leg. So there are now devices that actually deliver energy to your leg. You're right. You heard me correctly. There are devices that deliver energy to your feet that goes into your leg to be able to stimulate angiogenesis, blood vessel growth, and healing. Amazing, right? So these are electrical pads, right, that don't shock you, but they're flat pads. You put your feet on them. You kind of, if you're sitting in a chair, the perfect thing is that you can put them sort of where your feet are, and you can just rest your feet on it, and it actually delivers electrical currents right through the bottom of your foot, the balls of your feet. All right. And those electrical currents send signals to your blood vessels. And it actually, somehow these signals travel up the leg, the lower extremity leg, and they activate the leg to grow new blood vessels. Quite amazing. I've worked with people who have used it. It's actually quite dramatic in terms of the benefits that can occur. And it's a way, if you got black toes, maybe to actually avoid going towards the major surgery route. All right. Buy you some time, but also something you can do at home. So if you have an office, you can put one beneath your desk in your office. At home, you can put one, in front of the couch or maybe the dining room floor. So when you're eating, you can actually be on this current device, and it doesn't give you electrical shock. It's like low voltage, low current going into your leg, and that electrical therapy. All right, and listen, this is pretty amazing that like wound therapy can use electricity. They're even inventing electric bandages, by the way. Like not the brand Band-Aid, but the little square in the middle of the Band-Aid, they're actually making electrical signals that can beam out as well. So an electrical plate that can actually do electrical signaling to stimulate angiogenesis is another way of actually addressing a problem that you might actually find in your feet that signify a much bigger problem of circulation throughout your body. And that's been the theme of this video. I study angiogenesis, your blood supply. Our body's got 60,000 miles worth of blood vessels. 400 miles are in your brain. The rest of it is distributed. There's a lot of blood vessels beneath your waist, in your legs, in your muscles, around your knees, going all the way down to your calves and then into your feet. When there's problems with those circulation, it's a signal that other things are going around, but you might see the cramping, the swelling, the wounds that aren't doing so well, the blackened toes. All right, these are all warning signs that something else in your body is going on. Your feet and your legs are the tip-off that you need to actually go see medical